Hello, everyone. Welcome to Faculty Spotlights for the College of Professional Psychology at the Chicago School. Today, we're joined by Dr. Roger Giovino, a clinical psychology faculty member with our Dallas Clinical Psychology program. Dr. Giovino, welcome.
Thank you. It's great to be here.
So right out of the gate, why don't you tell us a little bit about how you got into the field of clinical psychology?
Absolutely, absolutely. How much time do we have for this
As much time as you need.
Alrighty. So my journey into this field was a pretty lengthy one. Obviously starting when I was a kid. I was actually one of those kids who had ADHD growing up. And by ADHD, it was the hyperactive inattentive, so the combined type. So early on, I remember having experiences as a kid where I was so dysregulated. Like I'd be the person that was in choir and I'd start doing cartwheels down the aisle, which I was kicked out of choir for eventually. So I was the troublemaker.
Yeah.
And I've always had that idea of, well, why am I different from the other kids around me? Why don't other kids have the same types of challenges that I do? Even in school, just being able to pick up material and learn was always a challenge. I found that I had to work twice, if not three times as hard as everyone else. So my introduction to psychology was actually in a high school class,
Okay.
where I fell in love with it because it was offering me the explanations that I was searching for.
Yeah.
That just clicked with me. And from there, it's like, well, surely I'm definitely not alone in this, that there's other people who struggle with different types of issues like myself, whether it's ADHD, feeling really anxious, depressed, you name it. And that really started spurring my passion to really want to be able to offer up aid to other people who are in need. So that's where my passion really came from.
Yeah.
It wasn't necessarily giving us side gig therapy sessions to kids in the playground. It was from my personal experience and having that experience of being in a psychology course in high school that really allowed this to click for me.
Yeah. I think that's a story of a lot of us as psychologists. This getting introduced to the field and being really attracted to some of the insights we get about ourselves, but then kind of getting insights about, oh, maybe that helps me understand others better. Maybe I could do something with this to help other people.
Absolutely. And I think that's how I also turn my ADHD into something that I always thought was a barrier and not sound as cliche like a curse, to something that benefits a lot of the clients that I see, because I think different, and I could understand things from some clients' perspectives with how they think. So it really allows me to uh, be able to help it, I think, in a way that's congruent with how, you know, I would have liked to have been helped as well.
Yeah, it's not just about kind of the empathy that it helps create between us and our clients, but um, it's just a different perspective on the world that can be of really real benefit to others.
Absolutely.
Yeah. Tell us a little bit about what you enjoy most when it comes to working with students.
I love the creativity. I love that they're coming in with fresh perspectives, fresh ideas, really coming into this with an open mind. And I love getting the opportunity to be able to facilitate that growth and development, because ultimately they're going to be the future of the field. So I
Yeah.
want to cultivate that desire. And, my opinion is psychology should be fun. To
Yeah.
an extent, I think that we're all huge nerds for science, and that's what I want to cultivate in each of my students too. It's just
Yeah.
that passion and love for what they do.
Yeah, I love the creativity of students as well. And I love the idea, I say this often, but we're really training the next generation of clinical psychologists. And I think
Hmm.
that's an incredible responsibility and a really cool privilege to have.
Absolutely. Absolutely. I think the most gratifying aspect of it is when you see things start to click for them, when they have like those aha moments. I get it. I understand how this works. Not in the context of, oh, I understand how the skill operates,
Hmm.
but I understand how I could incorporate this skill into who I am as a person to
Yeah.
deliver it in a way that's either digestible or understandable for the client.
So, Dr. Giovino, as you think about kind of the responsibility that we have for training the next generation of clinical psychologists, and as you work with students, is there a particular skill or lesson that you hope every student gets as they move through the program?
Mhm. I think the biggest I have two
Okay.
things that always stand out to me that were always important in my clinical work that I hope that resonates with students is authenticity in the room. If you're not yourself or if you're pretending to be BF Skinner in the room, clients detect that. And
Yeah.
big part of what makes therapy so effective for clients is the relationship that they have with a therapist.
Yeah.
Counts for about 30% of client progress and client outcomes.
Yeah.
So the biggest aspect that I see is forming a strong bond with your client, an effective relationship by being a version of yourself that's authentic.
Yeah. Yeah. I think that's a critical lesson as you go through a clinical program like the one we have there in Dallas, frankly, in any clinical program,
Mhm.
is learning to understand yourself and accept yourself in a way that allows you to be authentically yourself in the room with clients. It's so critical. And it's a tough part of the program.
Oh,
Yeah.
absolutely.
Yeah. And the coursework's hard, right? But kind of
Mhm.
coming into as full a version of yourself authentically as you can is so critical.
Mhm. And even when I'm teaching, the CBT courses, you
Hmm.
know, a big bulk of it is the skills that they teach, but and what I notice is students will try and practice the skill maybe like Beck would do the skill. And one thing that I always try and do is, "You're not Beck.
Right.
Do it the way you would do it."
Yeah. Put your within the framework, how do you make you part of how it's delivered?
Mhm.
Authentically you.
Absolutely.
Yeah. Um, what advice do you have for students who are kind of out there now? They haven't entered a program, but they're kind of considering going into the field of clinical psychology, and maybe they're looking at different programs across the country. What advice would you give a student in that situation as they consider program options?
Biggest thing for me has always been do your research on the faculty.
Hmm.
Make sure that the faculty interests are also lining up with your interests and that you're going to
Yeah.
get that training that's important to you. For instance, when I was searching for a program for my doctoral education, what was important for me was finding a college that had strong emphasis on trauma. So doing the research on the faculty and even
Yeah.
the type of sites and experiences that they offer that tie into my clinical interest so I could grow in a way that I see myself doing therapy in the future.
Yeah, we were just talking about how critical the relationship is in the therapeutic environment. And you think about going through a doctoral program in clinical psychology, that relationship that a student has with the faculty is critical to their success and their development kind of in on the trajectory that they see themselves in the future.
Absolutely. Absolutely. And I think the closest relationships I've made were with some of my faculty. I'm still
Yeah.
in contact with some of the professors that taught me. So,
Yeah.
I think if selected properly, these are these are colleagues that you'll hopefully have years after you graduate that you
Yeah.
could fall back on if you have questions.
Yeah. Lifelong mentors.
Hmm.
So now thinking about a student who's kind of they know they want to go into the field, right? They're trying to pick a clinical psychology program. Could you talk a little bit about why you think the Chicago School is a good option for students?
Absolutely. For me, the biggest benefit and the reason that I also joined as a professor here was the practitioner scholar model. I
Hmm.
think that is so vital. I remember being a my first go round with undergrad, for instance, in psychology, we were actually taught by some professors who didn't have clinical experience. So we were taught
Yeah.
CBT by someone that didn't necessarily have the experience of doing
Yeah.
CBT.
They didn't do it. Yeah.
So there's a huge difference between being taught how it should look in a textbook versus being taught by someone who has that practical, real life experience of doing it. So you could
Yeah.
understand the nuances. And for me, I think that is one of the massive benefits that the
Yeah.
Chicago School offers is that the the staff is also within their clinical expertise have that real life experience doing what they're teaching.
Yeah, and it's not that you can't get a good education from a non-practitioner, but there's a
Yeah.
difference, right? There's a difference between being in a classroom with a faculty member that's doing currently what they're teaching and can infuse the
Mhm.
curriculum with kind of that going back to authenticity, that authentic experience of, okay, here's what the book says, here's what the research says, and here's how it gets implemented in real life. They kind of help bridge that gap between the science and the practice.
Absolutely. Absolutely. And the way that I've always learned best was from those real life examples that
Yeah.
professors would bring
Yeah,
in,
me too. Yeah.
which is I think it's something fantastic that we offer the students.
Well, Dr. Giovino, thank you so much for joining us today and letting us get to know you a little bit better.
Yeah, absolutely. It was fun.